First time I went to Timor in 2004, pretty much the whole place was burnt out. There were lots of buildings burnt out. There was no infrastructure. One of the very first things that we did was to implement automation. So I don't know if you've ever had a blood test, but the blood goes onto machines basically. There was nothing in Timor in the way of automation. It was all manually done, which is very slow and quite inaccurate. So to put machines in that did the analysis was a huge leap forward, and that started really our work up there in developing people's understanding of pathology as a service.
I went to Timor last year as part of the basic life support training program, and I really enjoyed it. I felt that it was really good to see what we as a private organisation can do for people who have very little, and that was really great, and I've never been so proud to be a St John's employee as I had when I was over there.
The term alternative realities is certainly dropping into another reality. The facilities are quite simple. The access to equipment and to what we would expect in an Australian hospital is just not there.
Originally I was asked to be part of this program looking after the Timorese nurses when they came to Murdoch. Well, I guess what I see as the role is to ensure that it's welcoming and so that it meets the needs of their training.
I have been observed directly and how to prepare the medication like IV fluid.
The nurse here, when communication with patient is friendly, lovely.
We've seen nurses dramatically impacted by the experience and go home to become advocates for change within their own system. And it's really developing the leadership of Timor-Leste's nurses of tomorrow.
One of the big success stories has been introducing ventilation into the neonatology ward, and at last count there were about 33 babies who had been treated through ventilation and handed back to their parents, and that's 33 babies who are alive today who wouldn't have been alive today. You know, the best improvement is not even about technical, it's about how the Timorese have developed pride in their own work, pride in the wards, and pride in the fact that they're able to give better patient care.